Now in this video, I'll be talking about the different ways of describing disease occurrence using data gathered using descriptive epidemiologic methods, which I have talked about in the previous video. Now, I hope you still recall what descriptive epidemiology is from the previous video. Now, reviewing what descriptive epidemiologic methods are about in the context of this video, they basically provide ways of organizing and analyzing descriptive data so that we can be able to detect and understand variations in disease frequency geographically and over time, and how disease or health states vary among people based on a host of personal characteristics, which, as I mentioned in the previous video, are in terms of person, place, and time. Now, describing disease occurrences can be done using either numbers and tables or graphs and images. Now, basic statistical measures used to describe disease occurrence include measures of disease frequency, which include counts and prevalence and incidence rates. Now, person time at risk is also included here. Now, measures of disease frequency are used to describe how common an illness or any other health event is with respect to the size of the population at risk and a measure of time. Now, these measures, particularly prevalence, quantify the burden of disease in a population at a given point in time. Now, recall from previous that if we know the burden of disease, we can be able to plan health services better. Now, other statistical measures used are measures of central tendency, which report either the mean or median, measures of dispersion, which show how scattered or varied the data is, and measures of location, which involve quartiles, deciles, and percentiles, like when we talk about the top 25% or top 10% or even top 1% of something. Now, a very good example wherein measures of location are of importance is when we are charting the growth of children to see if they're lagging behind or not. Now, with graphs, it is pretty self-explanatory, so I'll leave it to you to read up on them on your own. And finally, we have spot maps, which show or mark the location of cases, and are very frequently used during outbreaks and contact tracing. Again, let me go back to the concept of descriptive epidemiology, which involves searching for patterns by examining characteristics of person, place, and time. Now, personal characteristics can include inherent ones such as age, sex, and race, and are generally non-modifiable. Now, personal characteristics that are modifiable, on the other hand, are typically characteristics that are acquired as one grows older, and include the following. Now, why is it imperative to know these characteristics in the context of disease investigation? Now, as I stressed in the previous video, these characteristics may actually be contributing to one's risk in contracting a disease of interest. Now, these characteristics can also affect or alter a host's resistance or susceptibility to, say, a particular infectious disease. Now, I'll start by discussing age as a personal characteristic. Now, age is the single most useful variable to describe occurrence and distribution of disease. Now, its usefulness in understanding risk factors of disease is a consequence of its association with the following: potential for exposure to a source, like work-related injuries or illnesses, for example. Now, clinical conditions that arise due to certain lifestyle choices are also included here. Now, the association of age with one's level of immunity and resistance explains why extremes of age are generally more susceptible or vulnerable to a number of clinical conditions. Now, disease can also be a consequence of age being associated with physiologic activity at the tissue level. Now, as I'll be showing in the figures that follow, age is associated with morbidity and mortality, and can be a function of the frequency and severity of disease at certain age groups. Now, here is data from the Department of Health here in the Philippines showing mortality rates per 1,000 population by age group. Note that as one grows older, the risk of dying from age-related conditions goes higher. Of note as well is that individuals under the age of 1 year also have relatively higher risk of death compared to the other age groups, mostly because of their physical vulnerability and perhaps relative immaturity of their immune systems. Now, here is COVID-19 data, also from the DOH, showing the percentage of deaths according to age group. The greatest risk of severe illness and death from COVID-19 is among those aged above 70, particularly among those aged 85 and older, according to WHO and CDC. Now, there are other factors that can also increase one's risk for severe illness, such as having underlying medical conditions. Now, this is United States data. I couldn't find any local data that is presented this way according to age group. Now you can pause this video for a while to note which conditions have higher percentages of deaths for each age group. Now you can see that for those between 15 and 24 years of age, motor vehicular accidents make up the majority of deaths, while for individuals 85 years and older, cardiovascular causes make up majority of the deaths in that particular age group. Now let's talk about age and morbidity. Now morbidity is basically the condition of being diseased, though in the epidemiologic sense, this may also refer to the rate of disease in a population. Now in this particular graph, we note that infectious diseases, generally considered to be childhood diseases, of course tend to appear or have a higher rate among younger people. Now Legionnaire's disease, on the other hand, mainly affects people aged over 50 years. The infectious agent is the Legionella pneumophila bacteria, which causes pneumonia in this case. Now, this is again United States data from 2011 to 2012, which features 3 pie charts. Now, you can see from these pie charts that individuals belonging to the younger age group make up the higher percentages for each sexually transmitted infection featured here, mostly because these younger age groups are relatively more sexually active than their older counterparts. Now, this is data from England as of 2011. Now in this particular graph, which is a frequency polygon to be more precise, we note that majority of newly diagnosed cases of cervical cancer is among women in the 25 to 29 year age group. Now as you will learn in pathology and microbiology, 2 human papillomavirus types, HPV types 16 and 18, cause 70% of cervical cancers and precancerous cervical lesions. Now HPV is a sexually transmitted infection that is generally acquired by the younger age groups and is the most likely etiology of cervical cancer in these age groups as well. Now, the CDC actually recommends vaccinating teenagers and young adults of both sexes against HPV to prevent cancerous lesions related to HPV infection. Now, the Canadian Study of Health and Aging is a study of the epidemiology of dementia in Canada. Now, it has followed over 10,000 elderly Canadians over a 10-year period from 1991 to 2001. Now, in this longitudinal study, age was found to be the strongest risk factor for Alzheimer's disease, and basically, the older a person is, the higher the risk. Now, just a few more points with describing data by age. Now, one should keep age groups relatively small so that differences in health characteristics between these age groups can be distinguished better. Now, I'll give an example of that next. Now, 5-year intervals are recommended for this purpose because the larger the groupings are, the more homogeneous an age group is treated. And with that, there is a danger of hiding important differences in distribution of health characteristics or cases of disease. Now, additionally, by using the appropriate age groups, age-specific incidence rates, prevalence rates, or death rates can also be computed. Now, here's the example I was talking about, stressing the importance of using appropriate age grouping. Now, let's say for a particular disease, we graph the reported cases per 100,000 population using the following age group here in this graph. We note a prominent percentage of said disease among children aged 0 to 4 years. Now, as you will learn eventually under pediatrics, there will be stark differences in characteristics among infants and children greater than a year old. Now, by designating the age groups this way, we're actually treating the 0 to 4 year age group as a homogeneous group when in fact this age group is quite heterogeneous. Now, if we adjusted our age grouping this way, in this graph here, this basically uncovers the fact that a vast majority of children reported to have the disease are actually less than a year old. Now, the next personal characteristic to discuss is sex. Now, sex can be associated with mortality because there are certain conditions that can put one sex at a higher risk for death compared to the other. Overall, though, males have generally a higher risk for death than females. There also exists an association between sex and morbidity. Generally, morbidity rates from all causes appear to be higher among females than males, probably because of higher healthcare-seeking behavior observed among females. Likewise, some diseases are more common in one sex over the other. I will flash a slide later on showing different sex-specific clinical conditions. Now, sex differences are also believed to be due to the following: different environment, usually work-related, as well as different patterns of behavior when it comes to recreation and travel, the presence of sex-linked inheritance of characteristics in certain diseases, and differences in hormonal dynamics and balance. Now, this graph features age-specific death rates from any cause per 100,000 population. The blue curves represent the males, while the pink curves represent the females. You will notice that for most age groups, the risk of death appears higher among males than females. Now, this is data featuring the trend of suicide in the Philippines from 1976 to 2005. Note that males have a higher risk for dying by suicide per 100,000 population compared to females. Now, many epidemiology books would mention that while females tend to attempt suicide more, significantly more males would be successful in completing the suicide attempt. Now, as mentioned earlier, here is a partial list of conditions that are sex-specific. Now, you can pause this video for a while to go over this list. Now, likewise, you will be encountering these conditions again later in the year and in your higher years. Now, let me give a brief discussion about race as a personal characteristic that can affect distribution of disease. Now, you'll learn eventually that there are certain diseases that are more common in certain races. Sickle cell anemias are more common among individuals of African descent. Cystic fibrosis, on the other hand, is a pulmonary disease that is solely seen in Caucasian races. Brugada syndrome, a type of channelopathy or disorder of the ion channels in the heart, more locally known as bangungot, has a higher prevalence rate among Southeast Asian males. Now, for a lot of these race-specific conditions, besides genetic variances, the environment, particularly the economic and healthcare access aspects of it, are also believed to be responsible. Now, certain customs, habits, recreational patterns, and patterns of diet may also have a hand in the development of these diseases. And lastly, there's also because of inherited characteristics. Now, one's occupation is also an important personal characteristic because a particular occupation can expose an individual to certain noxious agents that can put them at a higher risk for certain clinical conditions. And not only that, there are many office-based jobs that are very demanding in nature, and it puts involved individuals at higher risk for certain physical and mental stresses. Marital status is another important personal characteristic in epidemiology, because there are certain differences in the ways of life between single and married individuals that can be implicated in certain clinical conditions. Likewise, different religions can have different attitudes towards certain practices such as food intake, alcohol use, and the use of birth control. Finally, family size is yet another characteristic that may well be a risk factor for certain conditions because of how it can potentially affect the nutritional status of its members, how the household income is budgeted, as well as crowding in the household that can happen, particularly in poor living conditions we observe in our country. Now, besides describing characteristics in terms of person, descriptive epidemiology also observes for patterns with respect to place. Now, patterns in disease behavior may vary according to geographic distributions, for example, rural versus urban, and coastal versus upland. Now, similarly, there may also be certain localities where one would observe more of one particular socioeconomic category. Now, place in the epidemiologic sense could also refer to features or conditions that existed to describe the environment in which the disease occurred. For example, radiation, particularly in areas that have been sites of atomic bomb blasts, such as Hiroshima and Nagasaki, or nuclear disasters such as Chernobyl and Fukushima. Now, areas near a landfill site can be breeding grounds for certain infectious diseases. Similarly, rivers or other bodies of water can be breeding sites for insects that act as vectors in certain transmissible diseases. So, a place refers to a unit that can be as large as a continent or country, like in the case of ecological studies, or it can also be as small as a street address, hospital wing, or operating room, particularly when investigating disease occurrences that are much more localized in nature. Additionally, The following information about a particular individual can give some basis for the distribution of disease cases by place. Now, this figure is a map released by the WHO showing the geographic distribution of Ebola virus disease, or EVD, in humans and animals. Now, fruit bats of the family Pteropodidae have been suspected as reservoirs of the Ebola virus. Now, the area surrounded by the broken line borders represent the home range of these fruit bats. Now, at present, the only evidence associating them with EVD is the presence of seropositive individuals in 8 species and PCR positive individuals in 3 species. Now, Ebola has been reported actually before in the Philippines, but this is only among monkeys or domestic pigs with no evidence of transmission to humans. Now, what is important to note, however, is that deforestation or destruction of the natural habitat of these fruit bats, as well as the ingestion of these fruit bats, are significantly associated with outbreaks of EVD in humans. Now, clearly, in both instances, there's increased contact between humans and these infected fruit bats. Now, forest loss may also alter the natural circulation of viruses and change the composition, abundance, behavior, and possible viral exposure of reservoir species. And finally, patterns of disease occurrence can also be described temporally or in terms of time. Now, the time period invariably refers to the period during which the individual cases of the disease were exposed and the period during which illness occurred. Now, you will eventually learn that there are certain diseases that occur regularly or cyclically, while the others occur in an unpredictably sporadic manner. But in either case, displaying the patterns of disease occurrence by time is critical for monitoring disease occurrence in the community and for assessing whether public health interventions have worked or not in terms of mitigating the disease. Now, you will notice in all of the graphs featuring temporal trends of diseases that the x-axis of these graphs represent time, while the y-axis represents the number of cases. Now, in such graphs, the periods of exposure to various agents can be marked. Now, by noting how disease cases appear post-exposure, we gain insight into which particular agent may have caused the illness. Now, also in these graphs, we can mark along the timeline or the x-axis when control measures were implemented, and see with the number of subsequent incident cases of the disease if these interventions had any impact in terms of disease mitigation or not. Now, when graphing the patterns of disease with respect to time, we observe 3 general trends, all of which will be explained further in the subsequent slides. Now, a secular trend in epidemiology describes the occurrence of disease over a prolonged period, usually in years. Now, secular trends can be influenced by age distribution or by changes in the way a disease is reported, or even by changes in the definition or criteria of what a diagnosed case is. Now, it could also be influenced by the degree of immunity in the population and possibly non-specific measures such as improved socioeconomic and nutritional levels among the population. Now, we make use of secular trends to assess the prevailing direction of disease occurrence, like, for instance, whether the number of incident cases are increasing, decreasing, or remaining stable. Now, we also use secular trends to evaluate programs that have been implemented to see if there were changes in the number of incident cases of the disease, and from there, make the appropriate policy decisions. Now, another use of secular trends is to hypothesize if an agent is the cause of an increase or decrease in the number of incident cases of the disease. And finally, by using past trends, we can be able to forecast or predict any future incidents of the same disease. Now, this figure here shows the secular trend of incident measles cases in Poland from 1966 to 2009. Now, Poland belongs to the European countries with moderate incidence of measles, and following the introduction of routine immunization in the early 70s, we can see in this graph here that the incidence of measles has decreased. Now, from 2003 to 2005, the number of locally acquired cases in Poland was below the elimination threshold of 1 case per million inhabitants. However, since 2006, the measles incidence has increased and remained continuously above this elimination indicator. Now, this figure here shows the trends in incidence rates of various cancers in the United States from 1975 to 2008, stratified by sex. Now, it is interesting to note that there was a peak in the incidence of prostate cancer during the early 1990s. Now, this was actually the time when widespread prostate specific antigen or PSA screening was introduced, and this led to increased detection and diagnosis of prostate cancer cases. Now, just a few more statements about secular trends. We typically use curves to graph secular trends, as with a couple of examples I just gave, although histograms can also be used. Now, histograms are more appropriate, particularly when graphing epidemics or incident cases over shorter time periods. Now, the disease occurrence can be graphed by week or month over the course of a year or more to show its seasonal pattern, if any. Now, months or quarter years are often used in this case. Now, by graphing the number of new cases that emerge over time, secular trends can help show variations in case number, which may reflect variations in exposure to sources of infection. Now, I'll be showing you using the local COVID-19 situation as an example next. Now, being able to demonstrate these variations may help suggest hypotheses about how the infection is transmitted, what behavioral factors increase the risk, and other possible contributors to the disease or condition. Now, here's the nationwide COVID-19 epidemic curve taken from the August 31 DOH situationer. Now, here, confirmed cases are graphed by date of onset of illness. Now, we're kind of jumping ahead by showing you this since there'll be a separate discussion on it later, but I just want to stress the point that was made in the previous slide. Now, as you recall, Luzon was placed under Enhanced Community Quarantine or ECQ on March 17. Now, as you can see here, incident cases were relatively low, granted as well that we did not have that many testing laboratories yet at that time. Now, of course, this strained a country's economy very much. On June 1, the National Capital Region was placed under General Community Quarantine or GCQ status, thereby loosening the restrictions under the modified ECQ directly preceding it. Now, this, of course, was accompanied by changes in the way the virus was transmitted, so that is why shortly thereafter we see this subsequent surge of cases. Now, what if a recurrent pattern is demonstrated when graphing incident cases over time? Now, we no longer call that trend secular, but instead seasonal or cyclic. Now, here are a couple of examples involving influenza and rotavirus infections. Now, we have 6 years worth of data here. And notice the recurrent surge of incident cases occurring at specific months of the year when environmental conditions are believed to favor the thriving and transmission of these viruses. Now, be aware as well that we have seasonal influenza vaccines available. In areas where children are susceptible to rotavirus infections, rotavirus vaccination is given to them for 2 to 3 doses, depending on the vaccine, starting at 2 months of age, with doses 2 months apart. Now, children should receive all doses of rotavirus vaccine before they turn 8 months old. Now, cyclic patterns can also be observed within time periods as short as a day or a week. Now, using such time periods is particularly appropriate for conditions related to occupational or environmental exposures that tend to occur at regularly scheduled intervals. And I'll be giving a couple of examples of that next. Now, same as with any form of descriptive epidemiology, patterns that emerge may suggest hypotheses and possible explanations about a certain occupational or environmental exposure that could be evaluated with further study. Now, these two histograms from the CDC here graph the number of farm tractor accident-related deaths by day of the week and hour of the day. Now, we can see that the number of such deaths do not differ much from each other for all days of the week, except for Sunday when only a skeletal workforce will come in. However, if you graph these deaths by hours of the day, you'll see that the incidence peaks between the hours of 4 p.m. and 5 p.m. Now, from here, you can start hypothesizing if it is fatigue that's causing this increased number of deaths or poor lighting during these hours wherein most street lights are not yet turned on, and so on and so forth. And from there, you dig deeper into matters by testing your hypotheses using analytic methods. Now, the final trend to talk about is the epidemic trend. I will not be dwelling much on this because you will have separate video lectures that will discuss this topic in more detail. But just to define what an epidemic is, it is a marked increase in the frequency of disease over a particular time period. Now, it can be as broad as weeks or even months, such as the current pandemic we are experiencing, or narrow as minutes, like in the case of most food poisonings. And this depends on the most part on the incubation period and routes of transmission of the offending infectious agents. Now, I mentioned earlier that you graph incidence cases using an epidemic curve. An epidemic curve shows the frequency of new cases over time based on the date of onset of disease. Now, the shape of the curve in relation to the incubation period for a particular disease can give clues about the source. Now, epidemic curves are conventionally displayed as histograms, as I briefly mentioned earlier on. Now, in some instances, a single case is displayed as a square, and the investigator stacks these squares on top of each other in the graph if they occurred on the same day. Now, this makes it visually easier to count the cases as long as the number of cases are small and the epidemic is only short-lived. And of course, the shape and other features of the epidemic curve can suggest hypotheses about the time and source of exposure, the mode of transmission, and the causative agent. And as I mentioned earlier, the shape of the curve in relation to the incubation period for a particular disease can give clues about the source. Now, this epidemic curve in this example features the confirmed Ebola virus disease cases during the Ebola outbreak in the Bombali district in Sierra Leone from June 2014 to January 2015. Now, the x-axis represents time, while the y-axis represents the number of cases. Now, with epidemic curves, we can actually mark when key milestones came into effect, such as the start of the house-to-house campaign by the Ministry of Health and Sanitation of Sierra Leone, but that was not until 2 to 3 months after the emergence of the first Ebola case, during when number of cases peaked to a little over 100 cases in a week. But nonetheless, by indicating these key milestones along the epidemic curve, we can see from the trend in the number of new cases if interventions implemented were effective or not. Albeit quite late in the game, when the first Bombali Ebola treatment unit was established, we can see a drastic drop in the number of new Ebola cases thereafter. Okay, so I gave this example earlier, the one on the COVID-19 epidemic curve in the Philippines, along with the key milestones that I mentioned as well. Now, of note, it was around here when the healthcare workers called for an ECQ timeout, but were given an MECQ timeout instead. Now, either way, personally, I think calling for this timeout indeed made a difference. And finally, we can actually combine information on person and place, especially when we're trying to see if environment has an influence on diseases that seem to have high prevalence in certain ethnicities, such as gastric cancer among Japanese. Now, I'll be showing you a rather well-known migrant population study on cancer next as an example of this. Now, in this study, the investigators looked at selected causes of death among Japanese in Japan, among American residents of Japanese ancestry, and among white Americans for comparison. Now, the standardized mortality ratios, or SMRs, that were used were relative to a death rate of 100 in Japan. Now, from the results of this study, it appears that environment may play a major role in the development of certain diseases, as can be seen by a higher mortality rate from selected cancers and atherosclerotic heart disease among American residents of Japanese ancestry relative to Japanese who were born and lived all their lives in Japan. Now, this study was able to separate factors associated with place from those that are characteristics of person. And that ends this video series on the introduction of epidemiology. Now, please proceed to the video series on disease causation next.
Thank you, doctors. Thank you, nurses. Thanks for working the front line. Thank you, scientists. Thank you, pharmacists.